Good afternoon, everyone. We are so excited to have this next hour with you to discuss key strategies for a successful medical marketing program that can drive business growth and generate market demand. Hopefully, we meet your expectations with today's agenda. We'll be hosting a live Q&A during this webinar, so you'll have a chance to ask questions and get real-time insights. Feel free to drop your questions in the Q&A box at any point. We'd also love to hear what you're hoping to get out of today's session. So please feel free to share your expectations, and we'll do our best to tailor the conversation accordingly. Also, if you're experiencing any technical difficulties, please let us know via the Q&A box, and our webinar admin will assist you. We have a lot to cover, so let's dive right in. So to level set, excuse me, this webinar is for CEOs of MedTech companies, particularly early stage ones, marketing leaders of startup MedTech companies, and companies that are 18 months or less from launch. So if any of those describe you, you are in the right place. And who are we that are talking with you today? Well, I'm joined by Lisa Owens. Thank you so much for joining, Lisa.
Thanks for asking me.
Lisa Owens is a seasoned PR and marketing strategist with more than 3 decades of experience helping medtech and healthcare companies translate complex ideas into compelling stories. Throughout her career, she has successfully launched over 20 startup medical device companies, as well as more than 10 new product launches in the medical technology space. And I'm Lauren Dustman. I'm CEO of BMMG. And with over a decade of experience launching medtech innovations, I specialize in strategic marketing that bridges vision and execution. My work helps teams turn clinical breakthroughs into commercially successful products that gain traction and deliver results. Now, who is BMMG? Well, BMMG first began in 2014, and 11 years later, we are very proud to say that we've served over 100 medtech and biotech clients. BMMG specializes in helping medical device and biotech companies strengthen their market presence, generate demand, and attract investors. With decades of experience, we deliver innovative and results-driven marketing strategies tailored specifically to your needs. Also, scrolling at the bottom of the slide are just some of the clients we've served in our 11-year history. Finally, our founder just published a book, So You're Launching a Medical Device, which will be made available to you for free should you book a consultation call with us after this webinar, and it's also currently available for purchase via Amazon. And our last bit of level setting here before we get into the really meaty content is to show you what we consistently hear from leaders navigating medtech commercialization. You're thinking about timing, when to start building visibility without getting ahead of regulatory milestones. You want to build early demand, but you're balancing that with limited time and a lean team. Also, delegating marketing is not easy when there's no clear owner internally. And even if you know content is important, it's not always clear what that should look like or how to make it work across different audiences. We've seen these pain points across early stage and scaling companies alike, and you are absolutely not alone in facing them. And that's why thoughtful planning and strategic support matters.
So let's start with a reality check we've seen time and again in medtech. Hitting the market too early is just another way to fail if you haven't created demand first. There's a lot of pressure to move fast, especially if you're up against milestones, investor expectations, or competitive timelines. But launching without clear market pull is like lighting a firework in broad daylight. No one sees it, and it fizzles out fast. That said, launching early can work, but only if you've already laid the groundwork. And that comes down to one thing: demand creation. So the question is, how do you actually build demand before your official launch? That's exactly what we're diving into here. In the following slides, we'll walk through the 3-pronged approach we use to help medtech companies ignite interest, build momentum, and ultimately dominate their market even before FDA clearance. Let's break it down, Lauren.
All right. So you'll see this slide appear throughout today's webinar. We've created a visual map of our journey together so you always know where we are, what we've already covered, and what's coming next. Think of this as your roadmap, designed to keep us all aligned as we walk through each phase of the demand creation process. We will revisit this at every major milestone to help you track your project progress and connect the dots as we go. So at BMMG, we know that success in medtech isn't just about having a breakthrough product. It's about leading the market through transformation. That's why we don't just build marketing plans, we try to architect movements. And our three-phase commercialization process is designed to create the kind of momentum that turns innovation into adoption. And we call it a cogent strategy because it's clear, compelling, and proven to drive real change. So the first phase of that is building the foundation. Every shift in healthcare starts by exposing a gap. In this phase, we challenge the status quo, helping our clients articulate what's broken, why it matters, and what's at stake if nothing changes. Now, this is where we lay the groundwork for urgency and prepare the market for a new way of thinking. Phase 2 is shaping the vision. So with the foundation set, we start painting a picture of what's possible. This is where we guide stakeholders toward a reimagined future, one that reflects your solution as the obvious next step. We leverage thought leadership, education, and clinical storytelling to reposition the problem and recast your technology as the answer. In phase 3 is becoming the hero. In the final phase, we now shift the spotlight. Now that the market sees the problem and believes in the solution, we position your brand as the leader they've been waiting for. You're no longer just a vendor, you're the catalyst for change. This is where adoption accelerates and category leadership is earned. Now, each phase builds on the last, creating a narrative arc that sparks buy-in, drives urgency, and delivers measurable impact. Whether we're working in 90-day sprints or long-range programs, the results are the same. A market that's ready, receptive, and already leaning in.
One of the most powerful tools in persuasion is the classic problem agitation strategy, and for good reason. To inspire change, you have to first expose the flaw. That means shining a light on the limitation of the current standard, not in a way that scolds, but in a way that resonates. Because the truth is, most of the market already knows something isn't working. They've just learned to kind of live with it. Your role is to make the status quo feel completely unacceptable, to reveal that today's solutions aren't just imperfect, they're falling well short of what people truly need. Once that truth is clear, the door opens. Now they're not just open to something better, they're actively looking for it. And with your leadership, the message becomes undeniable. The way that things are isn't good enough anymore. So now that we've laid out the importance of building demand early, let's talk about the first phase of action, foundational plans. This is where we begin establishing your authority and planting the seeds for market transformation. This is really not flashy or sexy, but it is completely essential. These are the bricks that build long-term credibility and momentum. So let's walk through some starter steps. First, sign up for source of sources, help a reporter out, quoted, or something similar. These are free newsletters and services that make it easy for journalists and trade reporters to find you when they're covering relevant stories. And conversely, it makes it easy for you to find reporters who are writing about something that you can speak to with expertise. It's a simple way to start positioning your team as go-to experts in the space. Next, back your claims with peer-reviewed data. Every message you put out should be grounded in credible evidence. Data isn't just about compliance, it's about building trust with skeptical buyers, especially in healthcare. Also, share your perspective broadly. Whether it's blogs, podcasts, opinion pieces, or even discussion forums, start using these platforms to shine a light on the gaps in the standard of care. The more you point out what's not working, the more attention your solution will start to receive. Also, look for news that you can amplify right now. This could be funding milestones, clinical data, successful filings with the FDA, IDE clearance, new leadership, anything that can signal traction for your company and your solution. We want to start building a steady drumbeat of visibility that primes the market for bigger moments to come. Finally, everybody groan, engage with Your community on LinkedIn and Twitter or X. Companies who are active on LinkedIn are perceived to be nearly 40% more credible than those who don't. And companies with vocal CEOs have a nearly 11-point lift in reputation. So you have to be active and don't just give a follow, comment, contribute, and engage. This establishes you as part of the conversation, not just an observer. It's time consuming, but it's worth it. Eventually, this helps you cement your place as a thought leader, not just a product owner. Think of these as your day one moves. They're fast to implement and help shape perception before your solution even hits the market.
Thank you, Lisa. We're going to take a quick pause here and do a pulse check. And the question is, do you feel confident in how you're driving the dialogue about the problems with the current standard of care? This is one of the most critical areas when it comes to building market demand. If your audience doesn't fully grasp the problem or doesn't feel the urgency, you will really struggle to position your solution as essential. So just take a moment to answer honestly. It's okay if the answer is no or unsure, because that is exactly the type of challenge that we're digging into today. Excellent. All right, we're going to wrap up that poll. Thank you all for answering. Interesting to see the mixture of answers here. Okay, now that we've talked about building the foundation, we're going to move into the next phase, shaping a vision. So once we've called attention to the flaws in the current standard of care, the next step is critical, showing people what's possible. Now, this is the shaping a vision phase, because it's not enough to highlight what's broken. We need to offer hope, direction, and clarity about what the future could look like. Think about your audience at this point. They're frustrated with the status quo, but uncertain about their alternatives. Now, this is your chance to guide their thinking and shift their perspective. And we do that by answering a few key questions. Is there hope for something better? You want your audience to feel that change isn't just needed, it's within reach. Is anyone working on a new solution? By introducing the concept that innovation is already underway, you start to build trust and curiosity. You show that progress is happening and that it's credible. How might this technology work? You don't need to deep dive into the specs here, just provide enough to help people start imagining a new pathway. This invites buy-in without overwhelming them. And finally, well, what do the experts think? This is where validation matters, whether it's KOLs, early adopters, or respected clinicians. Showing that thought leaders are aligned with this new direction helps de-risk the vision for your audience. This stage is about delivering a compelling narrative backed by real value. You're guiding the market from a place of friction to one of excitement and paving the way for your solution to emerge as the next obvious step. Okay, so now that we've helped the market recognize what's not working, it's time to start shaping a new narrative around what could work better. This is the heart of visioning. It's where we invite stakeholders into the process of imagining a better future. So let's break down what this looks like. Start by shaping the conversation around the ideal solution. The goal isn't to pitch your product yet, it's to lead a dialogue around what an improved standard of care could or should look like. This primes your audience to want change and opens the door for innovation. Engage HCPs in defining what better looks like. This is one of the most strategic things you can do. Involve healthcare providers early. Ask for their input, listen to what they need, and let that feedback help inform your messaging and even your product development if possible. When they feel heard, they are much more likely to champion your solution later. And again, start sharing your insights publicly. As the vision becomes clearer, begin putting it out into the world. This could be through thought leadership, expert interviews, white papers, or even short form content. The goal is to build early momentum and let people know that there's a better future on the horizon. And finally, survey the market for unmet needs. Now this isn't just good marketing, this is smart strategy. Collect feedback, conduct polls, publish findings. Not only does this reinforce your credibility, but you can later point back to that and say, this is how we involved the market, and this is how we responded to its voice. Ultimately, visioning is not about pushing your product. It's about creating a shared sense of possibility and alignment, and that is what moves people to action. So let's just imagine a typical clinician working in a busy community hospital. Every week, he or she sees patients with symptoms that could point to, let's just say, coronary artery disease. And under the current standard of care, those patients are fast tracked through a litany of cardiac tests, only to discover that 9 times out of 10, their event was not even cardiac related. So now picture this. Instead of navigating a lengthy, expensive process, that same clinician has access to a fast, non-invasive tool right at the point of care. And within minutes, they get meaningful diagnostic insights before symptoms escalate or resources are wasted. It's not just faster, it's smarter, more accurate, and patient-centered. And behind the scenes, KOLs are already talking about this shift. They're publishing data, sharing real-world results, and asking the same question we're raising today. Why are we still tolerating yesterday's standard when the future is already here? This is what shaping a vision looks like. It's not hype. It's helping people see what's possible and then guiding them toward it. All right, now we're going to take a quick pause and talk about content. So the thing that I really want to drive home is that none of this works. Not the foundational outreach, not the vision shaping, not even the adoptive driving tactics, if the content you're putting out into the world is not intentional and strategic. This is so much more than marketing copy. The content you create is what shapes perception. It's how the industry begins to understand your value, your credibility, and your role in what's coming next. So, before we go any further, let's take a moment to talk about how to approach your content with purpose so that every message you share builds momentum and not noise. Lisa, take it away.
Okay. So if you followed the first 2 steps in this demand building process, laying the foundation and shaping the vision, then congratulations, you've already started creating high value content, whether or not you realize it. And as Bill Gates famously said, content is king. But in MedTech, content isn't just king, it's your currency. It's what fuels your launch, accelerates sales conversations, and builds trust at scale. By the time you get to launch, you'll be so grateful to have a robust library of assets, maybe blog posts or KOL testimonials, clinical insights, anything that can power everything from your website and social media to investor decks and sales enablement. So don't think of content as a side task. Think of it as the engine that will drive everything forward when it counts. Let's take a minute to talk about the role of content across the demand building journey, because the content you create shouldn't be one size fits all. It needs to match where your audience is in their decision-making process. I'm sure you've seen this funnel before, but we like to think about it in 3 stages: top of funnel, middle of funnel, and bottom, sorry, plus a layer of content that can be used across all stages. So at the top of the funnel is awareness. At this stage, your goal is to educate, spark curiosity, build credibility. This content is not about selling. It's about showing you understand the landscape and the unmet need. So, for example, thought leadership articles on trends or the future of diagnostics or surgery, white papers or ebooks diving into clinical challenges and innovation opportunities, explainer videos that simplify the medical problem your technology addresses, infographics showing compelling stats, patient journeys, or outcomes, webinars with KOLs that focus on the why behind the need, or clinical education blogs that build trust by offering value to your audience. Next, you move to the middle of the funnel, consideration. Now your audience knows who you are, and they're evaluating whether you might be the right fit. Here, your content should demonstrate how your solution solves problems and fits into existing workflows. So, for example, case studies or clinical success stories showing real-world use, product demo videos highlighting features, ease of use, and integration, comparison charts showing how you stand up to the standard of care or the competition, Customer testimonials, especially from surgeons or nurses, offer powerful social proof. How-to guides that speak directly to clinicians, procurement teams, or admins. Finally, you reach the bottom of the funnel. It's decision time. This is where you reduce risk, answer final questions, and help stakeholders move toward purchase. Effective content here could include ROI calculators or cost-saving tools to help economic buyers justify the investment. Regulatory documentation like FDA or CE clearance and quality certifications. Implementation playbooks to show that onboarding is smooth and supported. Sample protocols or workflow integrations tailored for clinical use, or procurement checklists that make it easier for buyers to take action. And then across this whole continuum, you have evergreen cross-stage content that works throughout the funnel, email nurturing sequences that guide prospects over time, social media content, think user stories, testimonials, meet the team snapshots, or behind the scenes look at engineering or HR, conference materials like posters, abstracts, speaker decks, or booth videos. The bottom line, your content isn't just about filling space. It's about meeting your audience where they are and moving them closer to action.
Thanks so much, Lisa. So now that we've laid the groundwork and shaped a compelling vision, it's time to bring it all home. We are moving into the final step of the demand building process, coming to the rescue. This is where we shift the spotlight onto you as the solution the market has been waiting for. Not just a product, but a partner, a leader, a catalyst for change. So let's dive into what that looks like and how to show up as the hero your market is ready to follow. So this is where everything we built so far comes together. Like I said, this is the coming to the rescue phase. And at this point, the market's already started to question the status quo. They're aware that there's a better way, and they're actively looking for what and who can deliver it. So this is your opportunity to step in, and not just as the new product, but as the answer to a problem that they finally acknowledged. So ask yourself, has your new technology officially launched? If so, now is the time to be loud and clear about it. Don't bury the lead. Make sure your audience knows you're here, you're available, and you're ready to help. Your company exists because you recognize the need. You saw the gaps in care, the inefficiencies, the misdiagnoses, and instead of accepting that reality, you built something better. That origin story matters, so do not be afraid to tell it. And then from there, think like a patient or a provider. How do I find this solution? Make it easy. Clear directories, provider maps, referral partners, anything that helps people connect with a point of access in their area. Well, when is it appropriate for use? Give real clinical scenarios. Paint the picture. Whether it's first line, point of care, or post-screening, set expectations and then empower decision-making. How much does it cost? So you do not need to share pricing on every channel, but transparency builds trust. Offer ranges, coverage information, or pathways to reimbursement. Meet the market where they are with the information that they need. And most importantly, how do people learn more? This is where your brand has to show up through your website, social media, sales materials, KOL webinars. Make it impossible not to discover your offering. At this stage, your job is to make it easy to say yes, remove friction, answer questions, and show up like the solution that they've been waiting for, because you absolutely are. So, all of that being said, how do you truly position your company as the hero, the one that the market's been waiting for? This is where you move from being a solution to being the trusted partner. This slide outlines a set of actionable moves that signal to the market, we're here, we're credible, and we are ready to lead. So let's walk through them. So number one is a market launch press program. So don't assume that the market will notice on its own. A strategic press rollout builds awareness fast, especially when amplified through industry-specific outlets and KOL mentions.
Hey, Lauren, I might add here that we look at market launch communication strategies through a lens that we call PISO, and we're going to get into that later in this webinar.
Oh, thanks, Lisa. Appreciate you highlighting that. So number 2 is a corporate responsibility program. Tie your brand to purpose, whether it's health equity, underserved populations, or patient education. This shows that you're invested in more than just your clinical success, clinical and commercial success. It's about impact. And Lisa, do you have a comment on this? Because I know you and I have talked a lot about this, and you really believe in this tactic.
I'm very passionate about it. So corporate social responsibility programs are a really great way to show your dedication to your community through philanthropy. So, for example, funding a national disease specific advocacy group or initiating a mission trip to address a health crisis that your technology can solve. The win is that it gives you something else to talk about in your communication channels that is not directly self-serving. It's about something bigger and greater than just you.
Excellent, thank you. So number 3 here is to pursue recognition. Awards and rankings, even if they're pay to play, which we will talk about later, they add credibility. They create validation points for investors, customers, and clinicians who are evaluating your solution. Number 4 is creating a find a center locator. So again, make access easy. Include a feature maybe on both your corporate and your patient-facing websites that connects people to where your solution is being used. The easier it is to find, the faster adoption will grow. Number 5 is about reimbursement and cost information. So you need to equip both providers and patients. Providers need CPT codes and coverage details, and patients might want to know what their deductible or copay might be. Clear information removes hesitation. And I cannot stress this enough. One thing that we've seen time and time again is that reimbursement and cost unclear, like not being clear about that, is the number one roadblock that a lot of companies see when they're trying to penetrate the market and generate demand. So really think about this one. Next is advocacy group collaborations. Partnering with patient advocacy groups helps you earn trust and reach new audiences. These collaborations also open doors to grassroots awareness and community-based education.
Let me throw in something here for any of our guests that are members of AdvaMed. They have a fantastic patient engagement program that goes through a number of best practices when you're collaborating with advocacy groups. So I encourage you to check it out, and our webinar management will throw the link in the chat.
Awesome. Thank you, Lisa. Next is customer programs. So highlight your programs that support users, whether it's clinical onboarding, patient engagement kits, or data sharing tools. These initiatives show that you're not just selling a product, you're enabling success. And then finally, drive website traffic with smart content. Use SEO-friendly content like questions to ask your doctor, include checklists, educational videos, or patient stories, and then pair that with your Find a Center locator, and you're creating a closed loop. You have awareness, education, and access all in one place. Now, these aren't just marketing tactics, they're strategic signals. They show that your company is not waiting for the market to catch up. You are leading it forward. Whew, that was a lot, but all very important groundwork. So now that we've talked about how to step into the spotlight as the market's hero, let's shift gears and talk about how we keep that momentum going through PR and visibility. So we're going to dive into our PISO model, and we're going to cover how to strategically pursue awards and recognition to add credibility and authority. Lisa, take it away.
Okay, y'all, buckle up. So let's talk for a minute first about how we amplify everything you've built, from messaging to momentum, using a modern PR framework. The PISO model we use is paid, earned, shared, and owned media. It's a strategic blend that gets your story told and heard across every major channel that matters. So let's break it down. P is for paid. This is paid amplification of your messaging. Think sponsored content, advertorials, or even social media ads promoting your KOL-led webinars or product stories. Paid is a great way to control your message delivery and extend your reach, especially when you're launching or scaling visibility quickly. Then there's earned. Earned media is the holy grail when trusted third parties talk about you. It's 3 times as credible as other forms of communication because it's perceived to be unbiased. Earned wins include things like journalist coverage, podcast guest spots, or blog features by influencers. This type of media win builds credibility fast, especially when it's backed by strong data or clinical insights. Shared media, the S of all this, is all about community amplification, social shares, mentions, reposts, and engagement to and from your audience. This is where KOLs, partners, and satisfied users can carry your message further. It's organic and it's powerful because it's peer-driven. Finally, owned media is what you control: your website, your blog, your email newsletters. This is where you get to tell your story your way. It's also where you establish thought leadership through articles, white papers, and videos that live on your platforms. Together, these channels work in concert. And when they're all aligned with your strategy, they create a surround sound effect that maximizes your influence, reach, and credibility across the industry. So let's touch base on one way that early stage companies can quickly build credibility that can be used throughout the PISO model: awards and recognition. Build yourself a trophy shelf that speaks to your innovation and credibility. It's meaningful to your current investors, potential future investors, your customer base, your internal team, talent recruitment, perhaps, and to customers. There are a plethora of award programs in the MedTech space that could serve this need. So, for example, you've got Prix Galien, which is often called the Nobel Prize of Life Science Programs. It's global, it's top tier, and extremely high prestige. The Fierce MedTech Awards, which are driven by the Fierce group of industry publications, is great for innovation, leadership, and commercial milestones, and it doesn't cost anything to enter that one. The MedTech Breakthrough Awards is a simple process to nominate yourself. They have really good visibility, strong branding, and they're well recognized. Frost & Sullivan is always looking for innovative companies, and that one is an excellent vehicle for business credibility and strategy validation. Finally, the Edison program is a kind of a broader innovation celebration, but they have key categories perfect for medical devices. And this one is particularly driven with a pay-to-play approach, making them kind of easy to enter and sometimes win. And of course, there are many other award programs in niche categories that could be pertinent to your innovation, for instance, AI or diagnostics or surgical robotics. So look for those too. There are also a number of general innovation awards worth considering. They could be moonshots, but the powerful return if you win them makes them worth considering. And they always have categories for medical innovation. So, for example, Fast Company's Most Innovative Companies, or Time Magazine's Best Inventions of the Year. These programs have tremendous PR reach, tremendous prestige, and they're globally recognized. And by the way, the Time program is happening right now. The deadline is next Friday. And the other thing I should mention is that some of these larger programs hinge on commercial availability. So if you don't have your FDA clearance yet, keep an eye on them as you get closer to commercial launch for participating in those. Next, let's talk about something sometimes uncomfortable but increasingly common reality: pay-to-play recognition. We want to be really clear. It is okay to pursue these. In fact, some of the best known lists and articles out there are pay to play. I'm sure you've seen them. Things like the 10 most innovative companies to watch, the 20 most inspiring leaders, military makeover, Operation Career with Montel Williams, or Ed Begley Jr.'s innovations. They sound impressive, and they are, but you are paying for the placement. So here's the truth. Yep, there's a cost, and it can be high. And yep, the process can be frustrating with time delays, vague communication, and editing cycles that make you want to pull your hair out. But here's the point. You're not doing it for the publisher's website traffic, late night viewership, or magazine readership. You're doing it for the asset it gives you, the logo, the headline, the credibility marker that you get to distribute. And what matters most is what you do with it after you pay to play. Add it to your homepage, include it in investor decks, share it on social media, use it in PR and sales enablement, or highlight it in recruitment materials. These programs are tools. You just have to know how to use them. I think Lauren has a good example of one success case.
I do. We worked with a client who went through that process Lisa was talking about, wanting to rip their hair out, very long review cycles, but they had a placement in a very well-known magazine. They had got an award, they had an article, and we decided to do a social media blitz to promote that award and that write-up. So we fleshed out a 6-week plan and gave this one piece of content a ton of runway. And when we did that, we almost doubled their LinkedIn following just with the activity that we generated. We were able to target very specific people in the industry and get the right eyeballs on this content to build validity, create trust. And their number of impressions and interactions with their post increased by thousands. So again, it's not the placement or the award itself that's the real gem here. It's what you can do strategically after that to drive awareness, build credibility, and establish that trust.
One thing I want to throw out before we move on to our case studies. So as a thank you to our guests for attending this webinar, we will provide you, I should say, with our 2025 curated awards list. It's intended to be a shortcut for you to help you decide which awards you might want to pursue based on your goals and the commercial stage of your company.
Excellent. Thank you, Lisa. And before we move on to our case studies, we have one final super quick question, but it is a meaningful one. So we've spent the last 40 minutes walking through exactly how to build demand the right way, early, strategically, and with lasting impact. And if you're thinking, this is what we need, but we could really use help putting it into action, you're not alone. So here's the question. Would you be interested in a discovery call to explore how we can help you build market demand ahead of your product launch or scale the momentum you've already started? Just select yes or no. We're unsure in the poll. And by the way, there's no pressure at all. This is just to gauge interest. If you do say yes, our webinar admin will drop a link in the chat right now where you can book a call directly with our team. It's short, casual, and focused entirely on your goals. So whether that's brand building, driving adoption, or preparing for commercial scale. So I see a lot of folks are already answering. We'll give it one more second on the poll, and we would love to connect with you one-on-one. All righty. So now that we've covered the full demand building framework and given you actionable next steps, we're going to bring it to life with some real world examples. We're going to walk through a few quick case studies that show how these strategies have been applied in the field, what worked, and what led to measurable results. And then after that, we'll open it up for Q&A. So get your questions ready or go ahead and drop them in the chat box now. Let's dive in. So we worked with a diagnostic imaging client developing a new modality for identifying suspicious masses. And when we began building demand, they were approaching FDA pre-market approval and needed to lay the groundwork for market visibility. The team started by preparing for award season early. They created a master list of common nomination questions like describe your innovation, how does it impact society, and how does it improve patient outcomes? Each answer was very carefully reviewed and approved by leadership to ensure accuracy, consistency, and compliance. So this pre-vetted content became a very powerful asset, allowing them to quickly and confidently apply to multiple award programs with minimal friction. They also allocated a modest budget to cover any nomination or application fees. Over a 2-year span, the company pursued 20 high impact and relevant awards to create sustained visibility ahead of launch. And they didn't just win, they amplified every single piece of recognition. Award logos and headlines were featured across their website, social media, and email signatures, press releases, pitch decks. The list goes on. And the result here for all of this amplification is that by the time they received FDA clearance, they had earned recognition by 6 different platforms and already had a warm funnel of interested customers who had been tracking their momentum. And they were ready to learn more as soon as the product became available.
Okay, so here's a case study that might be of interest to our guests who are in fundraising mode. When a CEO in the cardiology space joined her latest startup company after several successful exits at prior companies, her directive from the founders and the board was to move the company through a successful funding round and prepare for broad commercialization over the course of the next 24 months. From her previous experiences, she knew that one of the first places to start to overcome skepticism in the investor and clinical spaces was PR. And after sketching out her plans with her board and her founding physician entrepreneur, that was important, she called us in to develop a focused earned and shared media strategy. Hand in hand, we mapped out a series of cadenced, earned, and owned media opportunities to support the company's 24-month trajectory. We announced leadership hires and early clinical data, timed with one of the more influential conferences in the space, HRS. We shouted from the rooftops when we achieved an IDE from the FDA. And with every news release, we amplified it on social media, tagging our KOLs and our current and potential investors. We also coached the CEO with a social media thought leadership strategy to keep her on the radar. She spent dedicated time every week to posting relevant content as well as engaging with industry leaders and reporters on their content. Throughout the process, we secured several profiles of her in industry outlets, using her status as a female MedTech leader as the tip of the spear to discuss herself and her company. This led to some high-profile speaking engagements at investor-focused meetings. And after 18 months, with a series of earned media stories in industry vehicles and a remarkable social presence growth, we were able to announce a successful Series A close worth $15 million, beating our time frame by 6 months.
That is awesome. Thank you, Lisa.
They were pleased. Finally, here's a case study that shows you kind of the entire communication continuum using the PISO model. We had a client that had done next to nothing really to prepare the market for a novel new way to obtain vascular access during cardiac arrest. So when they realized that launch was imminent, it was scramble time. So we built out a full-scale PISO communication assault over 36 months with a consistent cadence of news releases, a vigorous social media program, and a focused effort to ramp up the chatter. So some of the things we did, we launched a corporate social responsibility program with a memorial scholarship sponsorship, as well as a humanitarian mission to Haiti during the cholera crisis. Again, giving us something to talk about that wasn't just about us. We went after a number of awards and won the unfortunately now defunct Wall Street Journal Innovation Awards, as well as numerous Best New Product Awards within the pre-hospital and emergency medicine categories. We developed relationships with KOLs who would evangelize for us, which ultimately led to 4 industry consensus papers advocating for the use of the device from the pillars of the clinical community. We launched a comprehensive social media program targeting clinical decision makers as well as end users to help us grow awareness. As mentioned, we pushed out news releases regarding sales activities, regulatory milestones, indication expansions, new board members, new adoptions, and case studies to keep the technology top of mind with the clinicians and with the end users. Here's where paid comes in. We developed a paid multi-page insert for a leading journal that ended up being reprinted 5 times due to user demand. We also wanted to try some guerrilla tactics that were new at the time. So we reached out to medical producers of popular television and movie projects to showcase the tool. And we got featured on ER, we got featured on Chicago Med, and we were included in the disastrous remake of Red Dawn. Uh, so today, the company was acquired in a $300 million transaction and has absolutely become the accepted standard of care. And if you recently watched The Pit on HBO, you saw this device numerous times in numerous episodes. It's the EasyIO vascular access system, which was the drill that they used to get into people's bones.
That is awesome. Thank you, Lisa. So now we're moving into our live Q&A. And I do see a couple of questions here. So Lisa, the first one is, how do I get on Help a Reporter Out?
It's a free newsletter. I don't know what the URL is, but you just try typing in like help a reporter out and it'll plug in your email and you'll get it. They send it out 3 times a day, but I believe you can change that to 1 time a day or 2 times a day. We'll follow up on the exact link for help a reporter out as well as SOS.
Awesome, thank you. The next one is, I have less than a second to influence a viewer's decision on LinkedIn. What is the best way to make them stop scrolling and read my posts? So I think that's kind of the age-old question that we get, because we live in such a fractured, like scroll society, that it's hard to grab people's attention. And so in my experience, and I'm happy to chat with you more in depth in this is you have to hold up a mirror to your audience so that they see themselves in your post. Are you deepening the pain for them? Are you addressing something that hits home for them? Are you thinking about what keeps them up at night, or what will move them to an action with what you're saying? What you're saying can't just be self-serving and about your product, your widget, your accomplishments. How are you pulling your messaging down to resonate with your audience? And Lisa, I don't know if you have anything else you want to add on that.
The only other thing I would say is images, graphics, something that can catch the eye.
Yeah, definitely. And one thing we've also seen too is, at least that I've seen, and Lisa might echo this, is that people like seeing other people. The images with actual people, teammates, KOLs, those tend to perform better on social media. Let's see. Another one is, what advice do you have for trying to sell your company? So Kate, we actually just did another webinar a few weeks ago all about accelerating your exit and about what strategic or what acquiring companies value, and different ways to develop brand awareness, accelerate growth, and drive sales. So I'm happy to send you a link to that webinar, as well as some of the tools that we shared for that audience. And I'd be happy to chat with you on a call about that too. Okay, so how do you begin to market your device pre-approval, pre-510K? Lisa, do you want to take some of that just from a PR perspective?
Well, I mean, I think we've kind of covered a lot of that, but
Yeah.
it's starting early, making noise, setting the stage for the problem that your device will solve. You have to be very careful about not crossing any lines because you're not cleared yet. So, what is the problem that you're trying to solve? How, what are the innovations in the industry? Why is it too expensive? What are, who are the people that you need to be prepping for? So if you've got a cardiology device, you need to be talking to cardiologists. But starting early and making sure that you're presenting that agitation now.
Right. And I think we had also said at the very beginning, there's a sweet spot, 18 months or so out from your launch. And somebody else had a question that kind of mirrors this, but you mentioned a need for approved products, but isn't there a gap in pre-approval where investors and BD groups can notice you? Well, yeah, absolutely. And I think part of what we're saying here, and I recall Lisa talking about needing an approved product, that was for some very specific awards. So the laying of the foundation, the visioning, and starting to shift the perspective of the market, that can all start to happen pre-approval. You just need to be very mindful of regulatory requirements and milestones as you're starting to build demand leading up to your approval. Awesome. Saw that thumbs up. Thanks for that. I do see another question here. And this kind of echoes what we were just talking about, but how soon should you begin making noise in the market? And is it dangerous to start too early? So again, you're ideally starting to build awareness 12 to 18 months before launch. And that does not mean pushing your product, but setting the stage like we just talked about with our foundational phase and our visioning phase. Starting too early can be risky if you burn out on your message. So if you overexpose the brand without clear milestones, or if you attract scrutiny you're not ready to handle, like regulatory questions you can't answer. But with the right strategy, early visibility creates a pull rather than pressure. Okay, here's another one. How do you get earned media? We have a novel we have a novel device that I'm sure any reporter, would be excited to cover.
Okay, so truth time. Um, Getting true earned media is really, it's a marathon. It's not a sprint. The best ways to get earned hits are not sexy, but they're tried and true because the key is building relationships. Reporters do not want to drink your Kool-Aid. Their job is to serve their readers. So you have to be able to create a story that would be meaningful to their audience, not yours. Just to set this kind of setting the scene, industry reporters, so like Connor Hale at Fierce MedTech probably gets about 300 emails a day. And mainstream reporters at, like, for example, the New York Times, they get over 1,000 emails a day. So what you're asking them to tell their readers about needs to be absolutely finely tailored to them and have a story about it, and it cannot be a sell sheet. So things you can do are be a resource to those reporters. Follow them on social media and comment or share their relevant stories, but don't DM them on social media. You can tie your technology to a trending news item. Be sure to, anytime you hit a milestone, get it out there. Tell reporters about it, but put it out on a wire distribution service to really get it out there. Be visible and be real about your expectations. You won't hit it the first time. It's a marathon. Also, just a hint that goes back to one of the things we were talking about before. One of the first things that reporters do when they're interested in following up on a story is to check out the company and the CEO profile on social media. So if your profile picture is a gray blob, or if you haven't posted in a year, they are going to read you as not a credible source, and they will move on.
Those are all really good points, Lisa. And I like what you said, it is a marathon, it's not a sprint for this. So that's a good expectation to set with folks. So another one is, you spoke of many types of content. What are the essential ones to have completed if I have limited time and budget? So if you're strapped, on budget, time, resources, there are kind of three things I think are essential. Number one is the foundation of your story and brand narrative. This is what builds trust, and it's what gives your company a relatable voice. You really need to put effort and time into that. Number two would be a clinical one-pager. So this is a very clear and concise overview of your product's clinical relevance and value, and how you're addressing the unmet need in the market, or, and how you're positioning yourself as the hero that they all need from a clinical standpoint. And then number three is a peer-to-peer selling tool. Peer-to-peer selling is the most impactful way to sell a product. So that would be a physician or early adopter testimonial. So that social proof is a very powerful shortcut to build credibility. And the thing about all of these tools is that they can be repurposed across your website, social media, award submissions, and even investor materials. So while you might only have, a couple pieces of collateral, you can then leverage that multiple times on multiple different platforms. From another viewer, is it a good idea to reach out to reporters before your product is able to be sold per FDA requirements?
It's not a bad idea, but reporters aren't going to cover it until it's commercially available. Now, I will say industry reporters are different than mainstream. So if you're wanting to talk to, I keep using the New York Times as an example, which is, Mount Everest. But if you're talking to a mainstream media, they won't want to talk about it unless a doctor can go and use it or a patient can go and use it. For industry insider publications, like I will use the example of Fierce again. Yeah, absolutely. They're looking for traction. They're looking for good corporate stories. And maybe it's not cleared yet, but you've got a big funding milestone, or you've hired away a seasoned industry veteran. Absolutely. You can. You just have to be careful about what you say as it relates to your product. One of the things we work with a lot of companies that are pre-clearance, and we, just like you see on websites, this device has not been cleared for use in the US. That kind of terminology always has to be included.
Absolutely. Thank you, Lisa. And I know I see a couple of more questions, but we are almost at time. So I'm going to go ahead and wrap it up. Thank you guys so much for being so engaged and asking some really thought-provoking questions. So again, we've covered a lot today, from the foundational demand building strategies all the way to market hero positioning and media visibility. But we don't want you to just leave this session inspired. We want you to leave it well equipped. So we've put together a set of additional resources that you can use to put these strategies into action immediately. We have our Creating Impactful Content one-pager. We also have our awards list, which Lisa referenced earlier. And then finally, if you need a more evergreen reminder of today's crash course, Lisa Bixel's book, So You're Launching a Medical Device, is a very practical field guide for MedTech marketers. And she covers a lot of the content that we discussed today in pages 23 through 27 of that book. So whether you are early in the planning process or gearing up for a big market debut, these tools are here to help you execute with confidence. So, and just let us know if you'd like any support putting any of these strategies into motion. We are happy to help. Thank you so much for attending. We hope today gave you clarity, inspiration, and a practical framework to build demand the right way before, during, and even after your launch. So again, not to beat a dead horse here, but if you are looking for tailored support, please book a call with our team. Whether you just need help refining messaging, launching a PR push, or building that top of funnel momentum, we are ready to jump in and move fast. So thanks so much for attending. We'll follow up with the recording tools and slides shortly, okay? Have a good afternoon, everyone.